Sculptra is,
So good.
oh, it's so good. It's
so
like,
good.
yeah, I look at a face now sometimes, and when I see that you need Sculptra, I just can't unsee it until I've told you about Sculptra. And you may be here for your Botox. I'm like, but I have to tell you about Sculptra.
What is Sculptra? So unlike dermal fillers that we use in the lips or sometimes in the chin or the jawline, Sculptra is a biostimulatory filler. And so it's making you make your own collagen. And so the places that we see where you've lost volume over time, cheeks, temples, jawline, this preauricular space here, even in your nasolabial folds, we can correct that, all of that with Sculptra. Usually my rule with Sculptra is 1 vial per decade, but I start treating patients as young as 30 all the way up to 70, 80 years old. And that's because it's this very subtle, natural, delayed gratification kind of treatment. For Dr. Holman, for example, we have treated in her hairline, and it's just kind of pulled everything up because over time her body starts making that collagen where she's lost it in her temples, and it just kind of gives her this nice, not a facelift, but it pulls everything back, it opens things up. But for like athletic younger patients, it's a great treatment for your temples where you start to get a little bit hollow, if you've noticed that. I think I heard a trainer one time, a doctor, call it peanut face, not very nice, but he's talking about that deepness that you get here, the hollow in the temple. Cheeks, it's a great correction. Underneath your nose, we start to lose volume right through here. These are things that maybe you don't look in the mirror and specifically say, I'm losing volume in my piriform aperture. But Dr. Holman and I can look at you and say, we know what would make a huge difference, but something so subtle that it would take 6 to 8 weeks to even see that difference.
So Sculptra's idea when you come in and you say, I want a very natural correction, but I want an overall correction. Because when we do a Sculptra treatment, I've got enough product that I can do an overall correction, that I can look and say, okay, you need a little bit here, you need a little bit in your cheek, you need a little bit in that preauricular space. But the cool thing about Sculptra is, so again, different than those HA fillers, which are kind of what everybody thinks of with fillers. With those fillers, you walk out, you're as full as you're going to be, and then it's going to decline depending on the product over 9 to kind of 15 months. With Sculptra, you're going to walk out and be like, I look awesome. And then 2 or 3 days later, when swelling and stuff has gone down, you're going to go, and where did it all go? And that's because it's going to be your collagen that's going to fill in these areas. But because of that, there's a few things that, of course, as a dermatologist, we love about that. Because kind of in this dermatology world, we're looking for very natural corrections, non-surgical corrections. When you build your collagen, guess what? It's your collagen. And so a lot of times we're going to start folks off with like a series of 3 treatments to really get this great overall correction. And then it may be every 2 to 5 years we're doing 1 treatment just to top off that collagen gas tank, essentially. I loved what one of my patients told me. She was coming in for her Sculptra treatment. And she said, my husband asked me where I was going, and I said, I'm going to get some fertilizer.
It's so true.
I know, and that's really what it is that you're, building your own stuff. But the other thing, when you've done a series of Sculptra, your skin looks fabulous.
Because collagen glow.
Yes, everything looks shiny and new, and it's just a natural lift because, again, we're replacing where the aging is happening. We're not just chasing lines through there. We're saying, why do you look tired? Why don't you look like you did before you lost that weight? That kind of stuff too. We're replacing those areas. Another place that we see too where Sculptra was first really approved in, and when I see this kind of defect or a place that needs correction on a face, I can't think of anything but Sculptra. It's when folks, and a lot of times I see this in really athletic women, or sometimes it's just a genetic pattern of aging, but it was initially approved in HIV guys who would get this thing called lipoatrophy. And so it's where you get this kind of loss of volume right through here that's really specific, and it gives you that really almost kind of skeletal look there to your lower face. And Sculptra is beautiful in that area because I've got enough volume to use. You build your own collagen through there, and it's a great correction. But one of the most natural corrections that we can do is with Sculptra, and it's a good starting place too. Like, it's a great starting place to get this overall natural correction, and then at the same time, we may do a little bit like of a lip, those kind of things too, with our traditional HA fillers or some Sculptra, and we do some laser that we're treating your skin as well and revolumizing at the same time. And so we use a ton of Sculptra around here because it gives you long-lasting and very, very natural results.
So today you're going to watch us treat a patient who's had Sculptra before. So we are just kind of spreading fertilizer all over that lawn. She's going to look a little bit puffy today. We use a cannula, we numb, and we use a cannula, so there's no downtime. She'll just be a little bit puffy today, a little overfilled looking. In a couple days, like Dr. Holman said, it'll look like nothing's done. And then she'll start that slow process of collagen, building her own collagen.